G'day and welcome back to the channel. So today's video is for anybody dealing with pain from hand arthritis. Now this is something that I see clinically a lot, but there's one thing that I've discovered over the last few years that I think is invaluable for you to understand in order to try and give you the best chance of decreasing some of that pain. And I'm fully aware that that may sound strange considering we're very clear when we say that because your hand is arthritic and we don't currently have ways to reverse that process, that any pain or tightness and stiffness that's associated with that is also hard to reverse as well. But what I've come to understand clinically as a physiotherapist is that just because you may have hand and finger joint arthritis, that does not guarantee that it has to be painful. So what I want to do in this video is I want to show you one really basic thing that you can try to see if this is causing your pain beyond the arthritis in your hands and fingers. And if it is, one day I hope to revolutionize our thinking around hand arthritis pain and what we think is possible. So let's get into it. So as a physiotherapist, I'm very passionate about trying to understand the root cause of my patient's dysfunction. And with hand and finger arthritis, it's very easy for people to feel that arthritis is normal, that it's an expected part of being alive, that at some stage, once we get to a certain age, it's normal for your fingers to break down, to develop wear and tear, to degenerate, and potentially then become stiff and painful. But my inspiration for this video is my Auntie Glenys. So if I may, I'd like to tell you her story. So I don't see my Auntie Glenys very often. We live in separate states, but we happen to be in the same place at the same time for a family gathering. And Glenys, she's in her mid-80s, and she mentioned to me that she just started to feel a lot of pain in her hands and fingers, along with a lot of stiffness where she couldn't quite make a fist anymore. But what she conceded was that she clearly had some of the boniness and the deformation that we associate with finger joint arthritis. And as a lot of people do, she logically made this connection that because her fingers looked and felt arthritic and stiff, that the pain was just a natural part of that experience. And my experience as a physiotherapist has shown me that the issues that may have caused her pain and stiffness may not have actually been at her hand, but her neck. The nerves and the tissues that supply the function of your hands and fingers originates from the base of your neck and the top of your upper back. And lo and behold, when I asked Glenys a few extra questions, she mentioned that she'd been dealing with some neck stiffness as well. More importantly, Glenys had also volunteered that she'd been spending a lot more time recently looking down using her phone, reading a book, and also relaxing in her recliner, watching TV. And the reason why this was significant is because the positions that she showed me that she was getting into were creating an unnecessary hinge through the base of her neck and the top of her back at the levels that may potentially associate with the dysfunction in her hands and fingers. So what I did with Glenys is I had her sitting up in her chair, leaning forward onto a table, resting her head down, just trying to find and release some of the stiffnesses and tightnesses in her neck. Glenys felt an immediate sense of pain relief, and where she wasn't able to make a full fist beforehand, was now able to make the majority of a fist. And while it wasn't perfect, I didn't even touch her hands. And just by looking for some spinal dysfunction at the base of her neck, the top of her back, and reducing the amount of stiffness and tightness in that area with some simple mobilization techniques, we were able to restore some of the normal function to her hand straight away. Now her arthritis is very likely still the same. It still looked the same in terms of the bumps and knobs that she developed. But what this highlights is what I find clinically with my hand arthritis pain patients, is that just because you have some deformation or some degradation in the joints of your hands and fingers does not exclude you from feeling okay. And depending on how progressed it is, there may be a tipping point where it's maybe no longer sustainable to feel good with joints that have progressed that far. But for the overwhelming majority of people that I see, and Glenys included, the stiffnesses and tightnesses and pain associated with her hand arthritis happen to be more neck related, relating back to the shapes and posture she was in the most throughout the day, than it was specifically the degradation of those joints. And truth be told, I don't think enough people are talking about this, if not finding this at all. So what I want to do is I want to show you a very simple technique that you can do yourself now with a ball that can hopefully help you find and then reduce any of that hidden underlying dysfunction that may be setting your tissue up to be stiffer, tighter, and sorer than it needs to be, regardless of how arthritic the area might be. So as I mentioned, all we want to do here is take a ball of some sort. Now this is a lacrosse ball. It's relatively hard and dense. Depending on how you feel, you may need to start with a softer ball like a tennis ball. Because what we want to do basically is we want to go placing this ball about where the bump is at the base of your neck. So if we follow your neck all the way down towards your upper back, at some point you're going to come across a bump that stands out. Now this is the junction between your neck and your upper back, and it's a good place to start. And if we can put the ball in that spot, and just let it roll immediately off to one side, we then want to get you to either stand or sit and lean up against a wall. Now, if you feel like your ball wants to shoot out from behind you, or if you find it hard to reach back and put the ball in that area, you're welcome to put the ball into a sock or a stocking, throw it over the back, and you can maneuver it from the front. But essentially what we're looking to do is we're not directly on the spine, the bump's down the middle. We want to roll immediately off to the side and go looking for the spinal joints that are right next to it. And you might need to roll your body towards the side that you're on just to get a better purchase on the ball. But ultimately what we're doing here is we want to feel for anything that feels stiff, tight, restricted. It may or may not be tender, and then compare it to the same spot on the other side, because we want to get the ball to rest gently on the side that feels the hardest. You can stay here for 30 seconds, a minute, 2 minutes, whatever feels comfortable and tolerable for you. Once you've had enough of that, you can then move the ball up a little bit or down a little bit and go hunting for anything that you feel is stiff, tight, or restricted. And what I asked Glennis to do, and what I would ask you to do as well, is before you do this, take note of how it feels to make a fist, maybe how tight it feels, how sore it feels. If there's any particular motions or movements that you would normally do that let you know that your hands and fingers are sore, whether it be trying to open a jar or twist a towel or use a pen or a pencil, do that first to get a strong sense of how you feel before you do this. Because if we're going to do something that maybe doesn't intuitively make sense to you initially, we need to base everything on results so you don't have to trust me. Because if you can find a bunch of stiffnesses here and tightnesses here, again, that may or may not be tender, and when you spend some time here and ask them to respectfully relax and release, and you feel like it does that, then if you immediately come back and do the same things again and it feels instantly better, then you know that the areas that you were on are meaningful. And as we found with Glennis, as soon as we did that for 5 or 10 minutes, she immediately felt like her fingers would close better into a fist, and she felt that there was less pain associated with that experience. And having checked in with Glennis recently over the last few weeks, she's feeling significantly better just because we've mobilized and freed up some of that hidden neck dysfunction that was causing her stiffness and her pain in her hands and fingers. They still look as arthritic as they did when I saw her, but the difference now is that they don't bother her to the same degree as it did before. So if you are someone that's been struggling with any form of hand, finger, RSI, arthritis related pain, and you haven't looked at exploring how the function of your neck may or may not be impacting that, then you could genuinely be missing the biggest piece of the puzzle beyond the arthritis in that area. And it goes without saying, the other thing that we needed Glennis to do was to make sure that if she was able to free up that stiffness in her neck, she also now needs to pay attention to the shapes and the postures she's putting that tissue into every day. As I said, when she's reading or watching TV or using her phone, if she wants to protect against this sort of stuff coming back again. But ultimately, I genuinely hope that that piece of information alone is enough to give you something to work on. Please let me know in the comments down below how that experience goes for you. If this was helpful, please let me know by leaving a like rating on the video. Subscribe to the channel if you want more of this type of content from me. But as always, I do genuinely hope that that helps. I know how taxing and frustrating pain from arthritic hands and fingers can feel. So good luck, and I hope to see you in the next one. Bye.